Today we're going to have a very nice discussion on yoga for mental health, and we have got two experts amidst us today to discuss about yoga for mental health and its effects. So we have Dr. Shivarama Varambally as well as Dr. Hemant Bhargav from the NIMHANS Integrated Center for Yoga. So let me start off, Dr. Shivarama, with you as to why should someone practice yoga to help deal with mental illness?
In the recent past, we have seen that yoga has had a lot of effects in mental health. But in response to this question, I would say that two important issues are there. One is that there are certain limitations in the current available treatments for mental health conditions, which may be psychosis or depression or many other things, which can be complemented with yoga. Many studies have shown that a combination of the conventional treatment or modern medicine along with yoga can produce a very good result. The second is that most of these mental illnesses have at least if not an origin, at least a factor of stress which worsens the condition. And as we all know, yoga is a very good antidote to stress. So these are the two things I would feel why yoga could contribute to mental health.
So can we say that yoga helps to treat mental illness, or to what extent can yoga help to deal with mental illness?
It of course depends on the condition that we are talking about. For example, we have shown that not only we, many centers around the world, we have shown that in depression, for example, for people with mild to moderate depression, yoga can be a standalone treatment or a sole treatment, almost comparable to antidepressant medication. Whereas in some other conditions, say for psychosis, of course you do need medication, yoga can be a complementary treatment. So it can definitely be used to treat people with mental illness, but possibly even more importantly to prevent mental illness. That is something that we are working on currently.
Okay. So in continuation with that, if I can ask Dr. Hemant, what are the mechanisms that work for yoga being effective for persons with mental illness, if you can delineate that?
Yeah. So one is, as Dr. Shivaram told, the reduction of the stress component in the disease. Second is that there are studies which show that yoga can bring about positive behavioral changes. So that also prevent a lot of risk factors for the mental illnesses. For example, the concepts of yama and niyamas, they advocate a positive lifestyle. So if those can be followed. Along with that, we see that there is a association of breath and emotion. So when we come across the emotional dysregulation, for example, if a person is in a state of anger or he's agitated or he's fearful, it is commonly observed that the breath also gets dysregulated during those emotions. So whether regularizing the breath brings about a more regularization at the emotional level, so we can go in a reverse way. Similarly, when a person is happy, he assumes a certain kind of postures. So if we can take those postures voluntarily, whether through the feedback the mind senses and brings about those kind of positive emotions back. This is one mechanism of action. Secondly, there are a number of studies which have shown that yoga can actually bring about a change in the neurotransmitters level in the brain. So GABA levels can be enhanced, so it has a relaxation effect on the mind. Similarly, the social bonding hormone of oxytocin can be increased. So yoga also enhances social connectivity, the feeling of connectedness, which can prevent and which can help manage these mental illnesses.
So is there any contraindication of doing yoga? I mean, you have said so many positive aspects and the mechanisms. So does someone need to be careful in doing certain practices in yoga for people with mental illness?
Definitely. In fact, I would advocate that yoga should always be done under supervision of a qualified therapist, because certain yogic practices, for example, there are fast breathing pranayamas in yoga, which may be detrimental for people having hypertension, or they may develop some kind of complications. Similarly, there are group of practices which should be avoided by people suffering from back pain or arthritis. So definitely we need to individualize the yoga session. Though we may be having a common yoga protocol, but for individual we need to add or delete certain practices which should be done by a professional only.
Okay. Now, since we are talking about yoga coming into the field of mental health and mental illness, most of the time psychiatrists have to advocate for yoga. So, if I can ask Dr. Shivram, how do you think we can educate psychiatrists, or what can be done so that yoga can be popularized and used, because it's seen to be effective in persons with mental illness?
It is true that the psychiatrist saying that you do or practice yoga would have a powerful effect, but even more importantly, I think it should be consumer driven. That the person who is going to the doctor, the patient or the caregiver or the relative, should start asking, can we also do some yoga? I get many people coming and asking me, can we take Ayurveda, can we do other things? So similarly, I think if they ask, that's one way of reminding the psychiatrist or the doctor who might be very busy about the potential for yoga. The second is, of course, scientifically sort of proving that yoga is as good as a treatment as any other thing. That has to be done through scientific studies, which to some extent is happening. Maybe in the last 10 years, the graph has been good in terms of scientific studies of yoga. So these two should happen, but if the consumer movement is there, I think that would have the maximum impact.
So, if I can ask Dr. Hemant in continuation, what are the specific practices that you would recommend to someone who is suffering from a mental health issue and condition and would want to practice yoga?
First priority is that the practices should be safe. It should not cause any harm. Second thing is that we have found that certain group of physical practices, then certain group of breathing related practices, pranayama, and the relaxation techniques. So we have developed validated modules for various psychiatric disorders at NIMHANS, and we follow something known as a generic yoga module, which is a 1 hour program. Now, for example, say for depression, we know that depression is a condition where the mind is in a state of low, and we would like the mind to get more energy. So for that, the practices are also more stimulatory in nature. So at the physical level, we emphasize more of back bending. At breathing level, we know that according to yoga philosophy, the left nostril is the moon channel and the right nostril is the sun channel. So the sun channel needs more activation, so more of right nostril breathing. And then the faster breathing pranayamas, also known as kriyas, especially the bhastrika fast breathing practice, and then chanting of the sounds a, u and ma, especially the ma component of the sound om. Has been shown to have a deactivating effect on the certain brain areas, probably through the stimulation of auricular branch of the vagal nerve. So om chanting also can be an effective practice in depression. And vice versa, for anxiety we would use calming practices more, so more of forward bending, left nostril breathing, and then certain other group of slow pranayamas like anulom vilom pranayamas, deep abdominal breathing, we would emphasize.
Any frequency for how long should yoga be done? How many days in a week? How much time period? Any suggestions for that?
What I would recommend is that at least 1 hour of the integrated yoga practices, where you start with slow warming up, then you do advocated postures, then you go to the breathing part of it. In the breathing also you do the faster breathing first, followed by the slow breathing, and then you come down to the relaxation parts. You can start with some chanting of the sounds a, u, ma, om chanting, and then followed by lying down in shavasana and doing abdominal breathing for cooling down. So this is the general program. It can be done once a day. And initial 12 sessions, I would recommend that they are to be done under supervision of a qualified yoga teacher, and once the teacher is sure that you are performing it correctly, then they with the help of a video or a list, they can be practiced at home.
Okay. It's often seen in persons with mental illness that taking a medicine itself is a huge daunting task, and caregivers find it extremely difficult to convince them to take medicines, and possibly that's much easier to pop in a pill than practicing yoga for an hour on a daily basis, if you're saying. So what advice would you possibly give family members or caregivers, or how would you suggest we can help improve the adherence to yoga, or to help convince patients to take up yoga and practice it for the treatment.
Yeah, it's also easier for the doctor to write a pill rather than advocate yoga. But what we have found is that people who do the yoga gain some motivation for continuing the practice. Unlike a pill which is seen to be something external, which somebody has prescribed and I should take, and so there is no role for the person himself or herself to own that. We feel that yoga is something that the person owns and saying that I am doing something to get better, rather than being a passive recipient of some kind of an influence from outside. So I don't think that there is that much of a problem. Of course, it is true that in this busy lifestyle, making time is a big issue. Even more so if you have to commute to learn the yoga, to go, say for example in NIMHANS, to come to NIMHANS, it takes a long time given the traffic in Bangalore especially. So that might be, logistic factors are a bit of an issue which we are trying to address through virtual yoga or online yoga sessions. Of course, like Dr. Hemant said, initially we would prefer that the person comes to the center or wherever the yoga is being taught, so that the instructor is able to teach properly. But beyond that, I think we have to come up with innovative kind of models. Now that internet is everywhere, that I think should be one of the ways to reach yoga and make sure people are able to do it comfortably. But if you compare, say, if you go to a doctor for diabetes, doctor will tell you do exercise, go to. So if you compare, say, going to the gym, where you need specific equipment, you may need membership, you may need all other things. Yoga, I think, is much simpler. So I think it's an advantage for yoga.
When you spoke about specific things that need to be done in respect to yoga, I also wanted to know that do we need to have specific modules for various disorders, or do we need to have specific modules? Dr. Hemant spoke about generic yoga. So can I go to a general yoga practitioner and learn practices to help improve my mental health, or do I need to follow a specific module and practices to help improve my mental health condition?
Ideally speaking, the yoga fraternity would like an individualized yoga module for each person, because each person is unique, their makeup is unique. But in practice, that's going to be very difficult because of the amount of expertise involved in doing that, and we feel that it may not reach all the people that could benefit from yoga. Therefore, we have tried to develop what Hemant called as generic yoga modules. The word generic here specifically means that it does not conform to any particular school or a philosophy or a cult of yoga. Rather, it is something that any reasonably trained yoga teacher anywhere in the world should be able to teach. So we feel that putting together a set of yoga practices could be helpful for most people with a particular illness. Whereas if that person, say for example, has some other factors, health issues, other issues, it may need to be individualized a bit. So I'm not saying that exactly the same has to be followed for each person, but what we may do for many patients is that when we talk to them, we find out that they cannot come back to NIMHANS. We give them the list of the practices and ask them to get it taught by the local yoga practitioner, and most yoga practitioners are happy to do that. So I think that's eminently possible.
So I have heard that the NIMHANS Integrated Center of Yoga has a number of modules for various disorders. Could you please throw light, Dr. Hemant, as to what are the various modules and how is it different from each other?
So we have validated yoga modules now for various mental health conditions: schizophrenia, depression, anxiety, mild cognitive impairment, somatoform pain disorder, and now we are working on developing a yoga module for opioid dependence or people suffering from substance abuse also. So obsessive compulsive disorder also we have a validated yoga module. Now validation of a yoga module involves a thorough literature search of the scientific and ancient literature to come up with the most useful list of practices, and then they are given to 10 experts in the field who have worked in the area of mental health as well as yoga for minimum duration of say 5 years. And then the list of practices for that disorder is given to them, and then on a Likert scale they mark it, and we use certain statistical calculation and cutoff point to remove certain practices and retain the practices which are advocated by most of the experts. So through that, scientifically we publish those validated yoga modules, and then we start using them for our research purposes and clinical applications. So therefore, as I told you, that the depression module involves more of stimulatory kind of yoga practices, whereas anxiety module deals with more of calming down. For a module which is for somatoform pain disorder, we advocate more of stretching things to increase endorphin levels, so that they generate endogenous endorphins. Similarly, for substance use disorders, there are yoga practices which have been advocated for improvement of willpower and a kind of bringing a deeper relaxation to the mind, and to reduce their craving and other side effects that are associated with the withdrawal symptoms. So the every module has a specific objective, what are the things that need to be addressed, and based on that we develop that.
Dr. Shivaram, you also spoke about how the NIMHANS Integrated Center for Yoga does look at virtual yoga and online services, with India coming up with the Digital India campaign, and the internet and the online web space becoming extremely important. If a client is not able to come to the center, or if a client wants services who is not staying in Bangalore, how would NIMHANS Integrated Center be able to help out with such clients?
Of course, at the moment we are restricting our services to people that we have already seen, because as per the law currently it's a grey area. It's like medical practice. Without seeing the patient physically, is it right to prescribe or teach, or is still not very clear. But we have done it for people who have been here, of course. For people who have not come to NIMHANS, what I would advocate is that they get in touch with a local expert there, who would then on their behalf correspond with us, and then we can go through that person. The virtual knowledge network in NIMHANS has been doing a tremendous job with this, rather treating the person through the local doctor or local psychiatrist or local expert has been a very rewarding exercise, both for the patient as well as the doctor involved in the exercise. So I would recommend that they can get in touch with us through the doctor there. It might be a physician, it might be a psychiatrist, who we can then go through to reach the patient.
Okay, I think we've had a very interesting discussion today. So before we close, can we have some take-home messages from you, Dr. Shivaram, as to what would you like to tell our audience and our people about yoga for mental health?
Thanks first, Aarti, for bringing up very important issues. The most important take-home message that I would want to say is that many people think of yoga as just a physical exercise. It is much more than that. And secondly, that it is a scientific way to sort of improve your health and well-being. There is of course evidence that it works in a host of mental health problems, but it's not something to be seen as mystical or something which is beyond the reach of most people. So I would want yoga to be investigated as any other modality of treatment, and we would probably get much more benefit from looking at it that way, rather than looking at it any terms of a religious or only a spiritual way. So it's something that we have to be open to, and I see that in the future it is going to be tested against many other interventions, and it's good because it will set the limits as well as the professionalism. It will increase the professionalism around yoga practice, and I think people should take home the message that yoga is helpful, and it's helpful just like any other intervention, but more importantly the person can own it.
Okay. So the take-home message is yoga is helpful. It should be used so that it could help improve the mental health of clients with mental illness. Thank you so much.